Good afternoon. Welcome to St. Clair County EMA office for our weekly COVID briefing. I'm joined today by St. Clair County Board Chairman Mark Kern and the Director of the Health Department, Mila Blandford. We'll go right to Mila for today's numbers.
Thank you, Brian. Good afternoon, everybody. For the reporting period of September the 23rd through September the 29th, we have 469 new positive tests out of a total of 10,567 for the reporting period. The age range of those individuals is under 10 to in their 80s. The weekly county positivity rate is at 4.4%, with the 7-day rolling average match at 4.4%. The regional positivity as of September the 26th was at 4.6%. Unfortunately, we have 5 new deaths to announce today. We have a male in his 40s, a female in her 40s with unknown health conditions, 2 males in their 60s with known health conditions, and a male in his 70s with unknown health conditions. Countywide, we have conducted a total of 474,408 tests, consisting of 39,239 positives and 435,169 negatives. The total number of deaths to date is 542, and our condolences go out to those families. To date, the number of individuals who've completed their 10-day isolation period is at 38,084. Statewide, we have conducted a total of 31,697,698 tests, consisting of 1,624,164 positives, which is an increase of 18,844 from last week. Total deaths to date is at 24,934, and that's an increase of 235 from last week. For St. Clair County hospitalization numbers, we have a total of 32 COVID patients in St. Clair County. Regionally, we're at 78. Patients on ventilators in St. Clair County is 3. Regionally, we're at 9. And Randy, would you like to share the graphic that the hospitals provided again today? So you can see that 28 of the 32 individuals hospitalized in St. Clair County with COVID-like illness are unvaccinated, which is right around 87.5%. Of the 6 in the ICU, 0 are vaccinated, and 3 on ventilators, 0 of those are also vaccinated. Okay, thank you, Randy. If you'd like to go to the age breakdown for this week, we can see that 13% of the individuals who are positive are under the age of 10, 28% are under the age of 21, and 57% are under the age of 41. So just slightly less than what we saw last week. Okay. For congregate care, announcing those in outbreak status, Colonnade of O'Fallon, we have 1 new case. The Shrine, we have 1 new case. St. Paul's Home, we have 2 new cases. And Willow Creek of Belleville, 1 new case. We continue to offer testing Monday, Wednesday, Friday, and Saturday at St. Clair Square and Fairview Heights. In addition, CVS, MedExpress, Walgreens. As most of you know, last week the booster for Pfizer was approved for certain age groups. That 3rd dose, or the booster dose, is supposed to be received 6 months after the 2nd Pfizer dose. The groups that were approved, the language is the individuals who are 65 and over should receive a booster dose, those in long-term care, as well as individuals who are 50 to 64 with underlying health conditions. Those underlying health conditions can include COPD, asthma, diabetes, obesity, chronic liver and kidney disease, and there's a list of others that you can find on our website. Individuals who may receive that booster dose of Pfizer are those individuals who are 18 to 49 with underlying health conditions, as well as those individuals 18 to 64 who are in occupations or in institutional settings, which may predispose them to a greater risk of COVID exposure. Okay? And those different occupations can include healthcare workers, first responders, postal workers, transit workers, food and agricultural workers, and again, that list can be found on our website and social media. Okay, Chairman Kern?
Great, thanks, Mila. Hey, Mila, if a person gets a flu shot, does that any way impact the COVID booster shot or a regular COVID shot?
Yeah, they can go ahead and receive their COVID vaccine at the same time as their flu shot.
And it's recommended this year, of course, that they get a flu shot?
Yes.
As normal. 13% under the age of 10.
Right.
There is no vaccination for children under the age of 10 or under the age of 15. Is 15 the cutoff?
12.
12 is the cutoff. So, so really that underscores the idea that anyone in that household really needs to get vaccinated to protect those who are unvaccinated, and certainly kids can't get vaccinated.
Right. So right now Pfizer has submitted data to FDA for review for those that are age 5 to 11, and they're looking at a third dose on those Pfizer shots. So more to come on that information. We'll keep you posted as more comes available. Again, we are offering that booster dose at our 330 West Main location. You can register online. We strongly encourage appointments. We're open Monday through Friday from 10 to 6 and Saturday from 8 to 4. In addition, on Tuesday, October the 5th, we'll be opening the fairgrounds for booster doses. That'll run Tuesday through Thursday from 10 to 8. And we strongly encourage appointments. As they become available, we'll have those posted on our website.
Okay, great. Thank you. We look forward to the fairgrounds reopening, just
Yes.
like old times. All right, let's take a look at the zip code report for this week, this past week. We start with 62201 today. They're up 6 to 792. 62203 up 5 to 888. 62204 up 8 over the week to 588. 62205 up 6 to 926. 62206 up 26 to 1949. 62207 up 5 to 918. 62208 up 21 to 2,241. 62220 up 17 to 2,771. 62221 up 43 to 3,742. 62223 up 46 to 2,382. 62225 up 3 to 240. 62226 is up 39 this week to 4,228. 62232 up 21 to 1,162. 62239 up 9 to 642. 62240 up 2 to 231. 62243 up 7 to 941. 62254 up 6 to 962. 62255 up 2 to 133. 62257 up 3 to 456. 62258 up 14 to 1,428. 62260 up 9 to 960. 62264 up 8 to 488. 62269 up 53 today to 4,341. And finally, 62285 up 10 to 726. Regional positivity as of the 26th of September is down to 4.6%, and our 7-day rolling average in the county is down to 4.4%. Mila, back to the boosters. Just to clarify, this is for people who have had the Pfizer vaccine only.
Right, correct.
So we only will offer a Pfizer booster because that's the only one that has been approved. What are people going to do that have Moderna, that have had the Moderna vaccine or Johnson & Johnson?
Well, we do hope to hear information about Moderna as well as Johnson & Johnson in the near future. Now, there is something also called a third dose. It's not considered a booster, it's a third dose for those who are moderately to substantially immunocompromised. So someone who's had an organ transplant, is on immunosuppressive drugs, cancer treatment. Those individuals can get a third dose of either Pfizer or Moderna. We're offering that at 330 West Main. The healthcare professionals there will question you as to what your requirements are, what your health history is, to make the determination of whether or not you qualify for that third dose. But as far as boosters, it's for those 4 categories that we discussed. That information's out on our website. And it is only for Pfizer at this time, and it's 6 months after your second dose of Pfizer. It can be longer than 6 months, but not earlier than 6 months. And while our positivity is a little bit lower, we are still seeing that our transmission rate in St. Clair County is at high. Anything over 100 per 100,000 is considered high, and we're around 147. So again, we still need to be cautious. Get your vaccine. That's the best tool that we have. We're making it readily available to anybody who's interested. If you have any questions, feel free to call the health department Monday through Friday from 8 to 4 at 825-4447. We can help you register for appointments for those booster doses if you qualify.
Great. Thank you, Mila. That was perfect. Brian, what have you got to add?
Nothing. Everything's coming along at the fairgrounds. We were down there again today making sure everything's ready, and it's going to be a sight to see when it reopens next Tuesday. You know, we like I said the other day, we had 100,000 plus doses administered there. Many people came through, were very comfortable with that process, and we want to make sure that it's ready for them to have that same experience.
That's great.
So we thank everyone for following us each and every week when we're here with you, bringing you the latest information. We'll be back with you again next Wednesday at 3:30 unless something comes up that we need to come to you sooner, and we will do that. Otherwise, we'll see you next week. Thanks for joining us.